Hello, today's video is concerning the TENS 7000 if you have been approved to use it and do not have any of the contraindications for electrical stimulation, such as a pacemaker or a history of cancer in the area. This is supposed to increase blood flow to the space, so anything you don't want to increase blood flow to, you would not use electrical stimulation for. So this particular unit, which is the TENS 7000, it's on Amazon, it's like $32. And this is what I use in my own clinic because it is so simple. Like there's no preset specifications. I can use it for bladder spasms, I can use it for pain control, and I can use it for increasing neuromuscular strength of weaker muscles. Examples for strength that we can use this for is if someone had a stroke and they are not able to bend their arm all the way, like they can kind of bend their arm, then we can put this on their bicep and it will help them get that arm all the way up. And can you imagine how helpful it is to be able to bend your arm and have that full range of motion? Also, someone who has had knee surgery and they can't straighten their knee all the way and they can almost straighten it, and then we put this electrical stimulation right on the muscle that helps straighten the knee, and then it helps them get that full range of motion. Typically, you don't want to do this forever. This is something just to bulk up the tissue quickly and to remind the muscles on how to activate, because the electrical stimulation gives it that added oomph. It feels funny because what I'm going to ask you to do is place this on either side of your anus. So when I had this done to me in the very beginning, I was in my 20s, I had no issues. I did not like this because it feels, numb, tingly weird at your bottom. And I did not like it. And so I did not do it on any of my patients. I told my boss, never buy that thing. That is horrible. I would never do that to anybody. Then I started having my own issues and I wasn't getting better as fast as I would like to. And I remembered that that was pretty helpful. I do it on other parts of the body. Why wouldn't I use that? Again, it seems like a disservice to not use that tool in your toolbox. So I bought it. I tried it on myself for a month and really liked the results, honestly. And so that's why I'm doing this video, and that's why I'm encouraging patients to try it with me. And if they like it, then they can always get the unit. It's only $30 on Amazon. So if you get this exact unit, then it comes with two little electrode pads that are about 1 inch by 1 inch. And I like to put rubbing alcohol on either side of the anus, so that way that those electrical pads can stay sticky as long as possible to just, and you would use that if you were going to use it on your arm or your leg or your back. You'd probably want to write on it that you were using it at your bottom. And that way, whenever your husband or wife wants to use it on their neck, they're not putting something that's been close to your BH on their neck. So it'll come with 4 pads. You're only going to use 2 of them. So the setting that I like to set this at, so you'd place these electrodes on, you'd connect them, do the rubbing alcohol, put this on that space at 3 o'clock and 9 o'clock of your bottom, really close to your bottom, because if you put it too far away, then you're on your glutes and your butt will tighten up and not your pelvic floor muscles. And we are trying to strengthen these innermost muscles. So right there. And you don't want to put it here because you've got, other very sensitive tissues right there. So there's not so sensitive tissues on either side of your anus. So then this thing is not fancy. It only goes up from 0 to 8. You're just going to turn it on to 1. There's no fancy like 1.1, 1.2. It's just like, I go by the speed of someone's eyebrows. So whenever you feel it, you'll be like, oh, I feel it. And that's how I know how to gauge how high the dial goes. So I set the mode to normal. So you're gonna push mode several times until it gets to normal. That whenever you feel it, it's just nice and steady. And then I'm gonna go to set. I'm gonna make sure the width is at either 200 or 300. It doesn't really matter because it's microseconds. So it's like da, 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 da. And I honestly can't feel the difference between 200 and 300. I think mine came at 300. I moved it to 200 just so I could see if I could feel a difference. I couldn't. You'll push set again and you'll move the the rate, the hertz, to 50. So if it's up at 150, then that's the setting that you would use for pain management. Or if you go all the way down to 5, 10, or 20, that's for bladder spasms. But 50 is specifically for that speed that you need to get that muscle activation. And then I push set again, and then I go, so it's width, rate, and push it again, and then it'll go to time. And I usually do 10 minutes. I found that was, there's some studies out there, and that's what they indicate is anywhere from 10 to 15 minutes. I feel like 15 is just overdoing it. I don't have 15 minutes I want to do with this on my bottom, and I can think of 10 minutes worth of exercises to do with this on. So, but not really 15. I don't know. I'm just not a fan of the 15. And I don't want to be sensitive to the adhesive. So you'd always want to check this on your arm to make sure that you can set this enough to bend your arm. So you can put it on your bicep, and that will help indicate if you have this on the right setting. So then mode is at normal. We've got width at 200 or 300. Rate is at 50. Time is at 10. And then you're ready to turn on the dial. So then you're gonna turn on the dial and you're gonna go real slow, because it only goes up to 8. And usually people feel it at 3, and then they can't stand it any longer at 4. This is a really sensitive space, so be kind and gentle to yourself, okay? Because I cannot feel what you feel. And you're gonna go all the way up, and you'll start to feel it around 3, and you'll be like, oh man, that feels weird. And you're gonna go all the way up until you feel that muscle activate, and it's gonna pull your anus up inside your body. And that's the Kegel, and that's what we're going for. I want you to remember that as it's Kegeling and as it's pulling that pelvic floor muscles up and in, that I want you to be doing that same thing by tightening up your abdomen. So doing that posterior pelvic tilt, squeezing your shoulder blades, because we want these bottom muscles to remember to kick in when you're engaging your lower tummy and your posture muscles. For example, when I'm running, I don't think about squeezing my butt inside of myself. I think about running with good posture, and then everything else just lines up. That's how we were made. Okay, so then whenever you find that uncomfortable spot, you're gonna push mode, and mine goes to 2 times to SD1, and that is my setting is for 4 seconds off, 4 seconds on. So you're laying there, you're on your back, you got these on your bottom, and it's going, and I want you to think about breathing in whenever it's off, so when you're resting, and whenever it's on, you're blowing out, engaging your core, having your good posture, and pulling your anus up inside your body. And you can just do that for a minute of just practicing, or maybe 2 minutes of practicing coordinating your breathing with your pelvic floor to allow all of your posture muscles, deep neck flexors, transversus abdominis, pelvic floor muscles to all engage at the same time. As a little bitty embryo, those 3 muscles are the same muscle until you get a rib cage that divides the deep neck flexors from your transversus abdominis. Then you get a pelvis, and that separates the abdominal muscles from your pelvic floor muscles. So they naturally engage all at the same time because they laid down at like 4 weeks at the same time as the same structure. So then I have modifications that I add, like little steps or little elbow digs or little punches or little Russian twists that you can do when it's on. So that way, as you're doing these transitional movements, your pelvic floor is being neuromuscularly reminded to engage and pull up your anus and do those pelvic floor contractions to limit how everything's moving. While you're laying on your back, you can do posterior pelvic tilts, anterior pelvic tilts, and you can feel the difference of how this feels as you're engaging and as you're moving. Because throughout our day, we're constantly bending over, we're lifting, we're breathing, we're twisting, and I want these muscles to know they gotta kick in whenever you're doing those transitional movements. So it'll go all the way to 10 minutes, and you're doing all of your little things whenever it's on. Remember, whenever it's off, you're breathing in, and whenever it's out, whenever you're breathing out, whenever it's on. Because our pelvis naturally moves back and forth with every breath. Every breath, I want you to think about if I took a big, big belly breath, our sacrum would open up. It allows our pelvic floor muscles to relax. And whenever we breathe out, the pelvic floor muscles naturally contract, the sacrum naturally moves in, and we help push all that breath out of our body. These are things we don't typically have to think about until we do. And then they're hard to think about because we weren't made to think about these things. So remember, all of that breathing, and that may take you a whole session just to remember how to do your breathing. So whenever it'll go off, it'll beep, 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 and it'll go off, and then you'll just turn the dial all the way to 0 until it clicks off. You'll unhook everything, you'll put the pads back on. I would write bottom on them so no one else touches them. And then you should just feel those muscles engage easier throughout the day, because they just had like a real pick-me-up. So I hope that you remember that you are fearfully and wonderfully made. If you have any questions, you can email me at stacy@ptofsanmarcos.com. So stacy@ptofsanmarcos.com. Thank you. Take care and God bless.